Good evening to everyone. My name is Mohammed Ibrahim, rheumatologist from Arbil. Today I will introduce to you a lecture on the anatomy. Please, when you notice on your Zoom toolbar, there is a place for chat. There is a place for raising of the hands. Please, if anyone of the audience has any questions, please try to raise your hand and I will ask you any comment or any questions. I will share my slide with you first. Introduction to the anatomy. Basic anatomy. Anatomy is a sign of the structure and the function of the body. Clinical anatomy is the study of the macroscopic structures and the function of the body as it related to its practice of the medicine and other health science. Basic anatomy is the study of the minimal amount of the anatomy consistent with the understanding of the overall structures and the function of the body. Descriptive anatomical term. It's important for the medical persons to have a sound knowledge and understanding of the basic anatomical terms. With the aid of the medical dictionary, you will find that understanding anatomical terminology greatly assists you in the learning process. The accurate use of the anatomical term by the medical person enables them to communicate with their colleagues, both nationally and internationally. Without anatomical terms, one cannot accurately discuss or record the abnormal function of the joints, the action of the muscles, the alterations of the positions of the organs, or the exact location of or the tumors. Terms related to the position, anatomical position. The person is standing erect with the upper limbs by the side and the face and the palms of the hands directed forwards. The various parts of the body are then described in the relation to the certain imaginary plane. Median sagittal plane or vertical. This is a vertical plane passing through the center of the body, dividing it into equal right and left half. Plane situated to one or the other side of the median plane and parallel to its termed paramedian. The picture will show you all these lines. A structure situated near to the median plane of the body than the another is said to be medial to the other. Similarly, a structure that lies farther away from the median plane than another is said to be lateral to the other. Coronal plane, these planes are imaginary vertical plane at the right angle to the median plane that divided the body into anterior and the posterior parts. Horizontal or the transverse plane, these planes are at right angles to both the median and the coronal plane that divided the body into superior and inferior parts. The terms anterior and the posterior are used to indicate the front and the back of the body, respectively. To describe the relationship of the two structures, one is said to be anterior and or posterior to the other is so far as it is closer to the anterior or the posterior body surface. In describing the hand, the terms palmar and the dorsal surface are used in the place of the anterior and the posterior. And in describing the foot, the terms plantar and the dorsal surface are used instead of the lower and the upper surface. The term proximal and the distal describe the relative distance from the roots of the limb. For example, the arm is proximal to the forearm and the hands is distal to the forearm. The terms superior and the inferior denotes level relatively high or low with reference to the upper and lower end of the body. The term superficial and the deep denote the relative distance of the structures from the surface of the body. The term internal and external are used to describe the relative distance of the structures from the center of an organ or cavity or for example, the internal carotid artery is found inside the cranial cavity and the external carotid artery is found outside the cranial cavity. The term ipsilateral refers to the same side of the body. For example, the left hand and the left foot are ipsilateral. Contralateral refers to opposite side of the body. For example, the left hand and the right foot are contralateral. The supine position of the body is lying on the back. The prone position is lying face down. Terms related to the movement. A side where two or more bones came together is known as joint. Some joints have no movement, and for example, skull, and some have only slight movement, superior tibiofibular joints, and some are freely movable, like shoulder joint. Flexion is a movement that takes place in a sagittal plane. For example, flexion of the elbow joint approximates the anterior surface of the forearm to the anterior surface of the arm. It's usually an anterior movement, but it is occasionally posterior, as in the case of the knee joint. Extension means straightening the joints and usually takes place in a posterior direction. Lateral flexion is a movement of the trunk in the coronal plane. Thank you very much. On the next lecture, I will continue the other parts.